Welcome back to the Eyecare Experts. I'm Dr. Bell, Dr. Terrezza, and we're joined by Dr. Stacey McDonald, the newest addition to our office. So welcome back again.
I'm happy to be here.
And coming up, we've got Contact Lens Health Week coming up here. So we want to kind of get in. That's the topic for today is contact lens. Talking about, I guess, different brands, but also just care tips, ways that patients can, I guess, have less chance for an infection, less chance of having contact lens problems in general. So you want to take it, start it? What do you?
Well, I'm just amazed that the field has so much innovation in it. I mean, this past week we've had 2 different lenses come on the market, and I'm not sure if AI was involved in the production of this. He hinted at it, the representative from Johnson & Johnson, but I've already fit this lens. It's a lens for astigmatism, for distance lens, and for intermediate and for near, all in one package. And I fit 3 patients with it so far, but I suspect there's going to be more. So it's very exciting.
Well, just thinking of, as you're saying that, I remember when I first started years and years ago, we used to have patients that would ask, you'd be doing the exam and they would say, hey, I have astigmatism. And they would think just because they had astigmatism that they couldn't wear contact lenses, that would exclude them. That's right. So to go from that to now you're saying we can correct for the astigmatism and the multifocal component, and the contact lenses correct both, not just one, is we've come a little bit of ways.
Wow.
So,
We've come a long way. I remember going over to the wall and picking up a glass vial off of a little shelf on the wall that had the patient's prescription strength in it and opening that lens and putting it on their eye. And then when we were done, taking the lens off their eye, cleaning it and putting it back in the vial and using it for the next patient. And now we just go in and we've got hundreds of lenses with disposable options, and you can put it on and throw it away when you're done. So it's been a big change even just since I got out of school. How we fit.
I mean, modalities have changed. I mean, even when I was little, we had what we called conventional lenses at that point, where you may wear a lens 6 months, maybe even 12 months, where most of the contact lenses, most of the ones we fit nowadays are either a monthly, you take it out at night, it lasts you 30 days. But, the daily options, there's been so many new dailies that have come out, like a daily disposable lens. And the reason for that is, I think we all agree that's the healthiest option, out there, less chance for infections, complications, and usually it helps patients who have extreme dryness and allergies and things like that. So I know when I first started, dailies were a little bit more expensive and patients were hesitant to try them, or at least to say, hey, but the prices have come down so much through the years where sometimes they may even be better than a monthly, and especially if you're not having to buy all the solutions and all that other stuff.
And they're a great option, the dailies, too, for people who aren't everyday wearers. If you just like to wear your contacts on the weekend, or you just wanted to wear them to play tennis or for sports or to go out to dinner, and you don't want to have a contact lens in your eye every day, it's a great option to just open up a fresh package, put the lens in, wear it for whatever purpose, and then toss it when you're done, and you don't have to worry about the lens being clean or picking up an infection, any bacteria sitting around in that case. You just start fresh next time. So it's actually more affordable to do that for a lot of patients than to buy a box of the monthly lenses. No,
excellent point. I had a 13-year-old today that I fit with daily contacts, and that's if you tear a lens, you lose a lens, it's it's a daily lens anyway.
Yeah,
in the old days, you tear a conventional lens, mom may say to you, hey, you're going to be wearing your glasses for 6 months or 12 months because that's a couple $100 lens. So.
And you're going to be washing the car and mowing the grass and everything else to earn that lens.
Exactly. But so we fit at all of our offices and locations. TerrezzaOptical.com. We fit all soft lenses. We fit RGPs, sometimes called hard lenses. We fit hybrid lenses. We fit sclerals, mini sclerals. We fit multifocals. There's fit for keratoconus, for corneoectasia, all the things you can think of. We can have access to any specialty lens, whatever we need to order, whatever best for that patient, to correct for the astigmatism, to correct for, let's say it's a congenital condition, anuridia or something like that. We can certainly get cosmetic lenses that help patients maybe to kind of minimize glare or light entering the eye. There's a lot of things out there that patients don't even know that could help them.
Right.
I agree. The thing that makes the most difference still to me at this stage of the game is the fact that seeing a patient come in with a fairly large prescription and put contacts on, and their whole demeanor changes. They sit up straighter, and in mostly the case of females, they look better, and they're very confident. Their confidence cranks up, and they're very happy with that, and I think it's a good thing.
Yeah, that's important for kids too. A lot of them need to wear glasses, and they won't just because of how they look or being teased by other kids. And so to have the option to put a child into contacts, and you can fit kids in contact lenses. There's no magic age of when's the right age to start. It really depends on the individual child and their responsibility and their vision needs. But to have an option for contacts for a lot of these kids that won't wear their glasses, it's good because now we've got them seeing and not worrying about, what they look like or being, teased by their friends or something like that.
And in some conditions, contact lenses may be the better option anyway. I'm thinking of a few cases where, we have patients who have a big difference in their prescription. And ISO is what we call it, where maybe one prescription's plus one, the other one's plus 8. And you can see the image size different in the glasses is hard for the binocular system to cope with. And usually with contacts, it's easier to kind of mesh or put those two things together. So in certain circumstances like that, contact lenses may be the better option. And in other cases, such as keratoconus, we can actually get patients to see better with a hard lens pushing on the cornea than we can get them seeing with glasses anyway.
Right.
So that might be the better option in those cases. So it, certainly we fit all that, as far as all the different lenses. We need to measure the corneal shape. We need to kind of get the prescription right. A lot of things go into that to get the patient's fit right.
Even the instruments to measure the tear film, its thickness, its components of its different substrates, those are all possible, and we have the technology to do that.
You were mentioning with keratoconus, some patients have had bad experiences with refractive surgery. They had a LASIK that didn't turn out quite the way they expected, or an RK procedure, and they've had complications afterwards. And a hard lens is really the best way to go for those people to help reshape that cornea and get their vision back to seeing better than they could with a soft lens or with eyeglasses as well.
And we still, we do have a few lenses that are approved for extended wear. I think we all see patients that certainly, work nights or certain things where they need a lens, and we want to fit you with the best lens for that. High decay value. There's some lenses that are approved for, some lenses that you'd have less issues sleeping with extended wear than others. And we'll go through that with you as far as what lens might be the best option for that individual.
Two of our doctors really enjoy nearsightedness prevention lenses, where wearing these lenses can reduce the amount of prescription that you have initially instead of waiting for it to develop and get more so. And we have two that very much like to do that and are active in that particular subspecialty.
Well, and that's a big topic nowadays, and not just here in the States, but certainly across the world, where kids are becoming more nearsighted at an early age. And we tend to kind of understand that if they're starting at -1, as they get older, most kids go that way, and then it increases. And when you get to be a high nearsighted or high myope, which we would say, it could cause issues with the eye. It basically means the axial length is longer, but if you think of it that way, it kind of stretches the retinal tissue where you may have a greater chance for retinal tears, detachments, and so that's where it's becoming a big deal as far as getting these patients early and slowing down that progression of the myopia or nearsightedness the best we can.
Yeah, this is a broken record. If you find something earlier and treat it quicker, you're better off, so you never get to the point where many of the complicated surgical procedures are not required.
Well, I think one of the advice I usually give is it's okay to be on phones. Just don't let your kids stare at the phone, especially like this, for 2, 3, 4, 6 hours a day. When I was a kid, we used to go outside and throw the baseball, play wiffle ball, or do something like that. Where the kids nowadays are just kind of looking inside at the phone all day, and that certainly could be triggering and leading to some of the issues that we're having as far as the increase in nearsightedness and stuff like that.
Absolutely. Not even just the phones. Me having a teenager in school right now, so much of their schoolwork is done on computers. And if you've got a child that's doing online school or homeschooling, they're doing a lot of their work close up rather than sitting and looking across the room at a board in a classroom or something. And all of that near work can really, push those eyes into becoming more nearsighted. So it's nice to have those contact lenses that we can use to help slow that progression of nearsightedness down.
And I think we talked in a past podcast, even going outside. We're talking about
yeah.
sunlight alone. They've done studies where
Vitamin D, yep.
Sunlight alone, and I think it was China, but they're trying to develop lights that will actually, you can use indoors to mimic UV light outside that actually helps slow down myopic progression.
Yep.
So that was another one there. But, certainly, we talk about extended wear versus daily wear. You know, things that can lead to issues with patients, right? Let's talk about that a little bit as far as things you may tell a patient to say, hey, make sure you don't do this or be aware of that, to kind of less chance to have an ulcer or an infection or something like that. I know some of the things I usually say is make sure you're dumping the solution out of the case every time. Make sure you're washing it out and letting it dry. Because a lot of people will kind of cheat and leave the solution in there and then kind of put more solution in there, and the solution just sits there for weeks at a time. And that could lead to you know, something on the lens. So just don't do that. Don't take the chance. If you ever have an ulcer or an infection really bad, it's not worth it. Trust me. Just empty out the case, start fresh every time.
That's like jumping in the same dirty bath water from last night. You just warmed it up and jumped back in there, and all the dirt and everything else that you washed off yourself last night is still floating around in the bathtub. And that's kind of how it is with these contact lens solutions. If you don't change that out every night, it's just full of germs. So dump it out.
And replace them. I mean, when they say with daily disposable, it's supposed to be replaced daily. Don't try to wear it for a week. And if it's, you know, we say it's a monthly replacement lens, don't try to wear that lens for 3 months, 6 months, or 12 months, because certainly the longer you wear it, usually the more buildup on that lens where there's protein or lipid, which is going to lead eventually to probably an ulcer, an infection, a conjunctivitis. I usually say you're playing Russian roulette.
Keratitis, yeah.
Eventually it's going to catch up to you. And it's just not worth it. It's not worth the risk. I mean, contacts are not that expensive.
Well, vision's too precious. You only get the two, and that's it.
And it's not like these things that we're talking about are rare occurrences that might happen but probably never will. We all see corneal ulcers every week. We all see complications from contact lens wear every week. We all see bacterial infections every week. So these are things that are happening. It's not that it's that uncommon. If it hasn't happened to you, you've been lucky, but your chances certainly go up by not getting those lenses out and changing them like you should.
And corneal ulcers, I mean,
They hurt.
There's no painful, light-sensitive, red, and if you get an ulcer centrally, I mean, that could impair your line of sight from now on. So this is not something that always is just, hey, I just need to drop for a couple of days and I'll go back and be fine.
And they can be expensive to treat too. You know, some of the drops and the treatments are not, you know, inexpensive. So you end up losing in lots of ways by not taking those lenses out.
And I think we've all seen patients certainly that have worn contacts for years and maybe overworn them, or they didn't take them out when they should, and it leads to neovascularization, vessels around the limbus. And there's patients that have so much scarring from ulcers or what have you in the past that we have basically said, hey, you know, at this point, you're doing a disservice to yourself, and, you know, glasses might be the better option.
Yeah, and if you're a younger person and you're doing that, starting young, you've got to remember you need your corneas for hopefully the next 60, 70, 80 years, or if you're thinking about having a refractive surgery when you get of age to do that, and you've messed your corneas up from contact lens overwear or misuse, you might not be a real good candidate for having LASIK or something later on to get out of those contact lenses, and now you're stuck wearing glasses for the rest of your life, and that's not where we want anybody to have to be.
So when you come see us, certainly we're going to do the routine, the full comprehensive exam, and then the contact lens fitting portion of it. Basically, you know, we're checking the corneal shape. We're trying to figure out what lens would best fit you. You know, do we need to just get you seeing good at distance? Do you need a multifocal? Do you need a toric lens? Do you need a soft lens? Do you need a hard lens? And then we also look at the corneal integrity. You know, what's the shape? What's the health? There's a lot of things we're evaluating with that contact lens fit. Because I get the question a lot is, you know, why do I need a contact lens fit? And why do I need a fit if I've worn contacts for a long time? And that's usually, I don't know if y'all want to expand on that, but certainly there's a lot of things we're looking at when we see those patients.
Oh, absolutely. Yeah. To find out, you know, the determination has to be made, is that fit still an excellent way to treat the front of that eye, or has the shape changed and therefore the lens is rotating too much or doing this or doing that, and we have to reevaluate that. If there's no change, you still have to reevaluate it and come to that determination that there was no change. It wasn't that no tests were done.
Right. You can have warpage of your corneal surface from contact lens wear, and thankfully we've got the equipment too to check for those types of things when we're doing contact lens fits. So there's a specific reason why we want to see that lens on your eye and check you every year and make sure you have a good fit still.
A few things I usually just say quickly is, hey, if your eyes are hurting you, if your eyes are red, take your contacts out. I mean, put on your glasses. And, you know, if it doesn't go away, you certainly come in and see us, but the worst thing you can do is keep wearing your contacts when your eyes are really red, they're irritated, they're light sensitive. Take the contact lenses out. I mean, how many times have we had patients coming in wearing contacts, and they can't even open their eye. So take them out, give your eyes a chance to breathe, and for most everything, that's going to help alone. And certainly if it's painful, light sensitive, come in and see us. That way we can get you on the right treatment plan, the right antibiotic, or whatever we need to do to get that healed up.
Yeah, don't ignore those symptoms. And we're always open to get you in. In any of our offices, if you call in with a problem like that, we're not going to make you wait a few days or next week to get you in. We're going to bring you right in and get that looked at. That's an urgent, need to come in for an exam, and we'll be sure to get you right in.
Last thing I want to kind of point out, and I know you'll probably want to expand on this too, is, it's so much easier nowadays. I guess we got a few things good out of COVID as far as that goes, but with contact lenses, pretty much any manufacturer we use have their own ordering system, and basically it's a QR code you kind of scan. And so even if you come in to see us in that day, let's say, hey, I don't want to order contacts, or I don't know what I want to do, if you scan the QR code, basically it'll give you a chance to order them. It'll have the pricing information. And the one thing that our office is we're priced competitively. We don't overprice contacts because we don't make much money. We want you to get what you need. That way you're not overwearing your contacts. That way you're not having any issues. And so we price them very competitively for that reason.
I think that's one of the major reasons why we have 8 offices, is because we're very competitive on the economic front. And I'm fine with that, and I'm good with that.
And the so the QR code, basically, it gives you a chance to order them, anytime you want to at your home. You could still give us a call and order them that way, but this new system and new method is so you can do it at your convenience. Do it at home if you're late at night. Let's say you work here, you can order them, and then it reminds you too, hey, you ordered a 6-month supply, you're running out, or you may be running out now if you need some more. So those things help the patient. As far as pricing and also just getting what you need, making it more convenient at a great cost.
One of our vendors has over-the-counter medications that will be delivered to you at no charge, and you can do that through this website with a QR code that you get at our office also. So there'll be more coming with that too.
Yep. Well, let us know. Come in to see us if you have any issues, whether it's office visit, if you have an issue with contact lenses, something's not working, something's not fitting right, or if you want to be fit for first time, or if you have questions to see if you can be fit, certainly come in to see us. We'd love to have you at any of our locations, TerrezzaOptical.com. Thank y'all for watching. Thank Dr. McDonald for joining us again.
Thank you.
It's been a great podcast. We appreciate it. Stay tuned. We thank you.